Pregnant mare's urine is where Premarin comes from. Sexy. Hormone replacement therapy is by far the most effective treatment for perimenopause and menopause symptoms. But unfortunately, it has a little bit of a bad reputation, so let's talk about why. There was a study called the Women's Health Initiative that was done, and in this study, women were using estrogen for menopause symptoms, and it showed an increased risk of heart disease and breast cancer, among other things. So this freaked everybody out. Everyone stopped using hormones because they thought it was going to be terrible for women. But there are a few reasons why this study was flawed. The first is the form of estrogen that was used in this study came from pregnant horse urine, and it didn't contain the same sort of estrogen that our bodies make. We now use more bioidentical forms of estrogen, such as estradiol tablets, when it comes to hormonal treatment that are more similar to our bodies and don't have the same risks and side effects. The other thing is the study included older women who should not have been receiving menopausal treatment because they were well past menopause. It's really only appropriate to receive hormonal treatment while you have symptoms and within about 5 years or so of menopause to really manage your symptoms, and then you stop taking them. All of these things drastically decrease the risk of side effects from hormonal treatment. Now, that being said, there are some people who have a higher risk of problems if they use hormonal therapy. It can increase your risk for blood clots, so if you have a history of blood clot or stroke, it may not be the best choice for you. And it can also slightly increase your risk of breast cancer, so in some cases, it may not be recommended if you have a history of breast cancer or a family history of breast cancer. Now, these are not hard and fast rules. It's just a matter of determining if the risk is worth the benefit. And that's a conversation that you should have with your healthcare professional who knows you, your symptoms, and your medical history. Together, you can decide what is and isn't worth the risk for you. The type of hormonal treatment you choose also makes a difference when it comes to risk. Things like topical patches or vaginal hormonal treatments don't carry the same risks as some of the other forms. So it's important to talk to your healthcare professional about that too. Keep in mind that if you have a uterus, you should be taking progesterone along with estrogen therapy. You should only take estrogen by itself if you don't have a uterus. It's so cute. Uterus fun.